Second pitch tonight from Kev Dhaliwal and Ian Wilson of Edinburgh Molecular Imaging, which is developing smart optical imaging to better diagnose cancer and infectious diseases. Kev and Ian, the floor is yours. Right, quick. Your clock's about to start. Well done.
Hi, I'm Kev. I'm a clinician founder of Edinburgh Molecular Imaging. This is Ian, the CEO. So EMI was formed 2 years ago with the central driving ambition to visualise disease at the bedside, that's seeing the light. In intensive care, an area of the hospital I work in, patients deteriorate rapidly within minutes on ventilators. And there is currently no bedside tool technology that can guide me to either start or stop antibiotics. Seeing bacteria deep in tissue at the bedside would change the way that we practice medicine. Now, this resonates with my surgical colleagues who are operating every day to cut out cancers, but they're using their eyes. They need to actually see the margins of tumours. So 40% of all patients who are having breast cancer surgery have to go back for reoperation because the margin is missed. That is devastating news for the patient and a huge healthcare burden to the NHS. And similarly in colonoscopies, where throughout the world hundreds of thousands of patients having colonoscopies by endoscopists, but the endoscopists cannot see which polyps are benign or malignant. They need to see it at the bedside. It is this need at the bedside that drives clinicians to see the light, and that's what EMI is trying to do.
Thank you, Kev. So how do we see the invisible and light up disease? So Edinburgh Molecular Imaging has invented some brightly coloured dyes that circulate the body and target disease, allowing the clinician to see that disease very quickly. So imagine you've got a little light bulb that you inject, a bit like this, hopefully it's a bit smaller, and it floats around your body, and when it binds to the disease in the lung, it lights up. And that light guides the clinician to where the disease is, allowing him to make a quick decision. We're already in clinical studies, and we've started to forge partnerships with all the hardware manufacturers in the world so we can offer a total solution. We've also got partnerships with major clinical sites in the UK, Europe, and the US who love our technology so much they're willing to help us drive these clinical studies. Our ask is very simple. We want lots of money. We want £7.5 million to drive these through multinational clinical trials and get them to the market, hopefully in 2019. So we're looking for partners who want to join us on this journey to revolutionise healthcare and aid diagnosis at the bedside with light. Thank you.
Very good. Right, excellent. So, guys, good pitch. We know how much money you want. How far will that take you? How big can you grow as a business?
Yes, it's a very good question. So it's an expensive game, developing drugs. We have to go through phase 1 and phase 2 and phase 3 trials. This money will get us into phase 3 trials in Europe or the US, so very close to the market in one of the lead indications that Kev described, which is colonoscopy.
But can you put a number on it? I mean, what's the return on that? And you've got a very exact figure.
Oh, okay. You mean what's the market size?
Yeah, what size of business could you create?
Oh, so these agents, we've gone through that analysis. In the surgery field or colonoscopy, these kind of products earn 200 to 300 million per annum.
Right. There you have it. That's the size of the opportunity at hand. Edinburgh Molecular Imaging. Thank you very much, guys.
Thank you.